Dr. Oger here to talk about other blood systems, and by other, I mean not ABO, different blood types. So there are a lot of these because, again, what's important to know about blood types is that it's based on the antigens that exist on your blood cells, and for the ones we're talking about, we're talking red blood cells. This affects the antibodies in our plasma cells, but there are lots of different groups of substances or antigens that can be and are attached to our red blood cells. So here are some other collections of those antigens, if you will. We have the Rh type. This might be the only other one you've ever heard of. So Rh positive, Rh negative. If I was asked what my blood type was, I would say O. If pressed for more information, I would say O positive. And that positive refers to the Rh type. This is the rhesus blood group. Rh comes from the word rhesus, like the monkey. And this is a very common protein, aka antigen, found on our red blood cells. It could be there or it can be not there. Those are the two options. There aren't like different versions of Rh groups. It's not like our ABO system. There's not like RHA, RHB. It's Rh yes or Rh no, positive or negative. Most people have it, 15% of people do not. If you don't have the antigens on your own blood cells, being exposed to the Rh antigen will cause your body to have an immune response and make antibodies and go and do the whole immune system thing. Having a negative person be exposed to a positive antigen has a process happen called sensitization, where you make those antibodies in preparation for a future exposure. This can happen if somebody who's Rh negative receives a blood transfusion and it's Rh positive blood, they're incompatible, or it could be if a Rh negative mom has an Rh positive baby. So this is just another type of antigen that can exist on our red blood cells, and most people have it, some people don't. The genes that are implicated in this blood grouping are, there's actually two, RHD and RHCE. They're located on chromosome 1, and these are inherited independently from your A or your B. So you can be A, B, AB or O, and be Rh positive or negative. There's no restrictions on combining ABO blood type with Rh positive negative. Each group could be either positive or negative, AB, AB, O. Because they're on different chromosomes, and whether you inherit a chromosome 1 from one parent has no bearing on whether you inherit the other chromosome that has the ABO gene on it. You're not always going to get, one from mom, the other one from mom, one from dad, other from dad. It's independent. When you make your egg or your sperm, whatever you make, it's just a genetic luck of the draw whether you pass on chromosome 1 from one parent or another, as well as, each of the other 22 chromosomes. It's random. So all combinations are available. We talk about Rh incompatibility a lot in the context of OB/GYN, prenatal care, and that's because a mom who is Rh negative, who has an Rh positive baby, will have produced antibodies through that process called sensitization, which is referred to back here, sensitization. And if those antibodies then see another Rh positive baby with Rh positive antigens, it will attack those Rh positive blood cells. Fortunately, we have cracked the system. Now we just test people and we give them prophylactic anti-D, which is what it's called, and that's reduced this instance of hemolytic disease of newborn, HDN, by 90% in areas where it is routinely used. Let's just watch this little short video to recap what we covered. Oop, that's not going to work. You should pause it and watch it. Wait, let me see. One more time. There we go.
The story of Rh disease begins with blood. Everyone on Earth can be divided into one of four major blood groups. But there's another category that differentiates us, Rh. Most people have a protein on their red blood cells called the rhesus factor. These people are Rh positive. But a small percentage of the global population is missing this protein, making them Rh negative. These two blood groups are incompatible. That means that if they mix, deadly reactions can occur. That's why it's dangerous when an Rh negative woman becomes pregnant with an Rh positive baby. If the baby's red blood cells get into the mother's bloodstream, her immune system will consider them foreign invaders and create antibodies to destroy them. These antibodies can also cross the placenta and attack the fetus, with terrible consequences like permanent brain damage and even death. This immune reaction begins during a mother's first pregnancy, but is only completed after the baby is born. That's why first babies are typically spared from Rh disease. They're already born by the time the mother's immune system has time to react. But an immune system never forgets, leaving all future Rh positive babies at risk of getting Rh disease.
So that first baby is produced while sensitization is still occurring and mom is making antibodies to the antigens. It's born by the time there are enough antibodies against those antigens, so it's safe. But then sensitization has happened, and as he mentioned, the immune system never forgets.
Rh disease was once a major killer, but in the 1960s, scientists discovered a cure by essentially hacking the immune system. With the help of human donors, they obtained the same antibodies that were hurting babies and turned them into a life-saving injection that helps prevent the disease. This injection is given to women before and after delivery, providing an antibody dose that is too small to hurt the baby, but potent enough to prevent the mother's immune system from reacting. It's as though these antibodies help mask the fetus's red blood cells, making them invisible to the mother's immune system. Today, Rh disease is virtually eradicated in wealthy nations like Canada, where the injection has become routine for at-risk pregnancies. But this cure only works if women can access the injection through an adequate healthcare system. In much of the world, this is still out of reach for many women, making the death and devastation of Rh disease a modern reality.
So still a very important issue. So, just to recap, first pregnancy, an Rh negative mother who's been impregnated by an Rh positive father, and this baby got Rh positive alleles that produce Rh antigen. This, as the blood comes in contact with the mother's blood, she will produce antibodies against that Rh antigen. It will build up over time during the sensitization process, and then the immune system will be ready for a second Rh positive fetus, and it would attack the fetal Rh positive blood, and it causes very severe complications that can lead to fetal demise ultimately. So, only a risk when mom and dad are different in their Rh status. And not just when mom and dad are different, when mom is negative and dad is positive. If mom is positive, she can have all the Rh antibodies, antigens. If mom has Rh antigens herself, the fetus can have Rh antigens and it won't be an issue. Likewise, if the fetus were to not have Rh antigens, that would also not be an issue. During blood transfusions, we have to carefully match the donor to the recipient, because if there is an incompatibility in antigen types, antibodies will attack those antigens, and it causes agglutination, which is a clotting process, and ultimately this has lots of health consequences. So this is why we want to know what people's blood type is before we give them blood. if at all possible, though it is not always possible, certainly. It's also a very good reason to donate blood so that there is blood available for people like yourself should you need blood. You want to get the right type. Here's a chart that shows who can give blood to whom. So across the x-axis here, we see the donor, somebody who is O. What alleles do they have? They would have two O alleles, right? Unless it's like a Bombay thing, but we're just going to assume no exceptions to Mendel here, no epistasis. Two O alleles for this person, and two alleles that do not produce the Rh antigen. So two O's, two negatives equals O negative. Because there are no antigens to either A or B or Rh, that means that it's not going to be attacked by antibodies. And so this person could donate blood to any blood type. O positive or negative, A positive or negative, B positive or negative, AB positive or negative. They are universal donors. People who have the O blood type that's O positive, what would their alleles be for the ABO system? Again, they would have two O's, unless it's some Bombay phenotype epistasis. And in terms of Rh positive genotype, they could either have one or two. But they at least have one because they're making that Rh antigen on their red blood cells, and people who don't have it would attack it with antibodies against it. And so thus, this person, because of this Rh positive status, they can only give blood to people who are Rh positive. But since they don't make A or B antigens, they can give them to people with O, as well as A, B, and AB. But they have to be positive. Somebody who's A negative could give blood to somebody who has an A blood type of either type. It doesn't matter if that person does have the antigen for Rh, they could still handle Rh negative blood being given to them. They would not attack that. And then likewise, somebody with A negative blood could give blood to an AB positive or negative person for the same reason. This person is not going to have any antibodies to either A nor B, and this person, AB negative, would make Rh positive antibodies and attack those, but an A negative donor is not giving those, so they could receive it, as well as somebody who has the positive Rh status. Somebody who's A positive donor has more limited options of who to give to. Other A positive people would accept it, as well as AB positive. They can't give to anybody who has no copy of A, because like these B people or these O people, because without A antigen on your blood, you would make A antibody and reject it. People who are B negative can give to anybody with a B, and it doesn't matter if they're Rh positive or negative, because having a negative Rh status isn't going to trigger an immune response. People who are B positive could only donate blood to other B positive people and AB positive people. They can't give to people who don't have a B, such as anyone who's just A positive or A negative, or O, because both of these people would be producing antibodies to B, having no B antigens themselves. Likewise, you can't give B positive blood to an AB negative person because, well, it could tolerate the B being there and not have B antibodies attack the B. The Rh negative status of the recipient would make it so that a B positive donor would not be a good choice. Somebody who's AB negative can only give to other AB people, because if you don't have both an A and a B, you're going to make antibodies to either the A antigen or the B antigen, and subsequently your body would attack the blood. And people who are AB positive are most limited in who they can give blood to, only other AB positive people, because now not only will you attack either A or B antigen with the relevant antibodies, if you don't have both, you're also having an Rh incompatibility issue if you are Rh negative. So all those people would be excluded. You should be able to tell if somebody could give blood to another person based on their genotype. That would be fair game on a quiz. Okay, so that's the Rh blood type, which you might have heard about, especially in the context of OB. Another blood type that you might not have heard about is the MNS type, and we're really not going to get too far into it, but just because I want to give a well-rounded lecture, we'll throw it in here. This blood group is due to genes on chromosome 4. You don't need to know what they're called, but it's glycophorin A and B. They are located really close together on chromosome 4, so we know that it's always on chromosome 4 because genes have a locus in our genome. These ones are so close together that they're on the same chromosome and they're nearby, so they're probably not even going to cross over. You're going to always inherit these together pretty much, and that's called a haplotype, which means that if I give you my glycophorin A gene that I got from my mom when I make my egg, I'm also going to give you the glycophorin B gene that I got from my mom when I make my egg. Or if I gave you the glycophorin A gene that I got from my dad, I'd give you the glycophorin B gene that I got from my dad when I'm making that egg. They don't get split up. The antigens in the system are very complex. There are 46 of them. We're not going to get into it, but you should know that some of the important ones that you might see being relevant to your patients potentially if you're in like hematology would be the M antigen, the N antigen, the big S, the little s, and the U. And you don't need to memorize these. Just know that there are a lot and that MN are included because, you know, like that's the blood group name. It's a super complex system. The M and the N are the heavy hitters. They made it into the acronym at least, and those also display this phenomenon of codominance, as do big S and little s, which means that you will produce the protein associated with the allele if you have it, and one doesn't trump the other. They will both be jointly expressed. One's not dominant to the other. They both coexist. We're not going to talk that much about this because this usually doesn't cause hemolysis after transfusion, so it's less clinically relevant. Okay, next type. So we've got Rh factor, MNS system, now this is the Kell type. This is on another chromosome, again, chromosome 7, and region 7q33, so it's on that Q arm, which is the lower portion of the chromosome. Two genes, again, Kell1 and Kell2, in close proximity, inherited as a haplotype. So single parent is going to give both. They're on the same chromosome, and they're really close together. No crossing over is likely to occur, which we know can happen in meiosis when you're making egg and sperm. There are a lot of antigens in this blood group as well, 35. They're relevant to fetal development, early erythropoiesis, production of red blood cells. Again, the antigen on the surface is an enzyme. There are a lot of common antigens, some that are very common and some that are less common, or more specific to certain populations. And you don't need to know the details. We also see codominance or joint expression of alleles in the Kell blood type. If you have a big K and a little k, you'll make big K protein and little k protein, and those will be your antigens on your blood cells, and then whatever antigens you don't make, you would make antibodies against those. There is a disorder associated with having too low Kell antigens, and it's actually interestingly due to the absence of another protein called XK, which is a gene on the X chromosome which can get deleted, and that follows an X-linked recessive pattern of inheritance and causes a certain clinical phenotype or syndrome. which includes having abnormally shaped RBCs, elevated CK levels, muscular deficits, and neurological problems. It can definitely have an impact on somebody's quality of life, for sure. Here we see an X-linked recessive pedigree, which tracks the transmission of a disease through a family, and we see some hallmarks of the disorder. So first of all, affected boys either have an affected mother, or if they have an affected father, they definitely have an affected mother because dad gives a Y chromosome to his son. So to get the mutated X chromosome, you need to have either an affected mom, or because it's a recessive condition and women would need two, you could have an unaffected mother. Any affected female in the pedigree has to have an affected mother and father because she needs to get two copies. Dad with a single copy would manifest with the disease. I guess she doesn't have to have an affected mother. She could have a recessive mother, but she's definitely going to have an affected dad. So more prevalent in males than females because it's easier to get one copy. More likely to skip generations through females who can be carriers. There's no such thing as a male carrier. Having one copy will get you the disease. And so affected daughters must have affected dads to get that second copy. As a woman, you need to have a dad who had one copy. He's only got one X. He'll have the disease.